Hi everybody, today I'd like to share another article about inclusion body disease in snakes, mainly boas and pythons. And I picked this one. This is a really good article talking. It's very one of the most truthful ones out there I came across. It's IBD is the most commonly diagnosed viral disease of captive boid snakes, boas and pythons. Snakes other than boids have been diagnosed with IBD. It is likely that all snakes are susceptible. It has not been diagnosed in wild snakes. So again, they're talking about it's mainly a captive bred or it's in captivity viral infection. And it's not completely certain, but I really believe that they don't even know the exact type of virus that it is. It was believed for decades it's a retrovirus, and it's a RNA virus that converts into DNA, meaning that the cells that the body produces of the infected animal will forever have these contaminated blood cells, and no matter what, this thing's just going to be highly contagious amongst all your collection, and all your animals are going to get it, and everything's going to be diseased and dying. And I really don't believe that is the case. I'm not sure exactly either the type of viral infection it is. I don't think anybody is. Of course, back in 2012, they were talking about it's an arena virus. It was believed to be from rodents. That's a possibility. It could have evolved. It's a virus. It mutates. You get different strains. I think more strains or more, less severe is the main disease itself. You could get a lesser strain of the disease of this virus, and you could take your animal into the veterinary clinic, and it can come back positive. And then people can take their snake and put it back, decide to keep it, nurse it, and later on down the road they bring it back and they say, "Oh, now it's negative," and now, "Oh, it was just a false positive." And it's vice versa. You could have a snake test negative, hasn't been exposed to any other snakes, it's been kept in good conditions apparently, or whatever, or what the keeper thought was good conditions anyway, and they bring the animal back and has IBD. And it's, well, we didn't catch it the first time. Well, no, I think it's a virus that they caught, and I think this virus progresses into IBD. Kind of works like the common cold in humans, I believe. I'm sitting here, and somebody could sit next to me. I could have a cold, a slight viral, a very minor viral infection. I just gave it to this person sitting next to me without me even knowing it. They get this cold, okay? They have a slightly compromised immune system. They, they go outside or whatever, they go about their business. Next thing you know, they get bronchitis, then they get pneumonia, and then they're in the hospital near death. To where I had the very same virus, and I got over it within a matter of a day or two, and I was fine. I believe that's basically how this IBD thing really works. Even though they're not sure how it's triggered, okay, nobody is. It's believed to be by mites. Well, yeah, if you have an infected snake with any type of virus and it goes to another snake, yeah, these snakes are going to get these viruses. But they also go on to say that there's been some small evidence that some snakes have recovered and test negative after they were tested positive, and that is true. A lot of people are in a hurry to put their animals down because they get this virus, and they're told it's a fatal retrovirus when I believe they don't even know 100% sure of that it is a retrovirus. And a retrovirus is a reverse transcription virus that basically connects, takes RNA and converts it into the animal's DNA and in humans, and it's incurable, supposedly. And the blood cells will forever be contaminated, and there's nothing you could do, even if the animal recovers. It's just not a good idea to keep it around other animals because the other animals could get sick because it always has this virus. But there's a lot of uncertainties here. Like I said, don't think it's a retrovirus. I really don't. They said it was an arena virus. I'm not sure if that's like falls in the same classification, but this article even proves that these are professional veterinary people that are been in the business for a long time. A lot of them are, and they're not even 100% sure of the exact type of virus and exactly how it works and exactly how it mutates and exactly how many strains that they're dealing with. They just know it's a viral infection. And the main thing to do, how you treat a viral infection, just like you would, see, there's not going to be any antibiotics vaccination for any virus, even in humans. Okay, they do is you take antibiotics to get rid of the secondary bacteria infections that boost your body's immune system to fight off the virus, and that's the same way how you would go about doing it with exotic animals. And I've been using the plant extract method to do that because watch any of my previous videos. I had a have a Central American boa male. He was a neonate when I got him, and he was ill at the time. Wasn't sure what was wrong with him. I nursed him for a couple months. He did get better, and then he got worse, and he got better, and then he got worse. He was back and forth. Finally, took him in November of 2020, and he told me that he had inclusion body disease. He did have like an east to west head wobble and was real twitchy movements and real painful looking, like you touching me, like had a pain reaction, but he was still feeding. And I decided to nurse him, keep him away from the others. The others had, I think, some other issues going on with them, another type of infection, because I acquired all three of these snakes around the same time, and all back in July, and they all had some kind of weird issues going on with them, but they're all fine now. I added polyphenols to their diet, plant extracts. I have their temperatures at 83 low side, 90 high side, all three of them. They're running about between 70 to 80% humidity. My true red tail's running closer to 90%, but I used reptifoggers because once they have a virus, I use the reptifoggers for dehydration purposes because once they're sick, dehydration kicks in faster, and that's what will kill them quicker is dehydration. So I invested in some reptifogger systems to keep their humidity levels up. I had to constantly change their bedding because you don't want the bedding to get soft and wet over time because then they're laying in that and then they can get scale rot. But at the same time, you have to have their ambient air at higher humidities around 80%. But now I just, was able to turn those all off and I put in bigger water bowls in there to compensate and they're doing just fine. And so I don't have to go in there and just constantly change their bedding, every couple days. They're back to big water bowls and I'm getting humidity. That's about the best effective way to get humidity in there in the first place in their tanks is to put a water bowl in there big enough for them to soak in. And I'm getting 70 to 80% in all their enclosures without the sopping wet bedding, and they're doing just fine. And I gave them the Governor olive oil with their frozen thawed, along with some plant hemp extract, omegas 3, 6, 9, vitamin C and E, along with vitamin D for the real sick one with his UVB lighting. And they all recovered and they're doing really well. And the little guy, I'll take him in probably, oh, maybe next year to have him retested again. And I wouldn't be surprised at all it comes back negative. And there was another article, another video I want to post that these scientists, I just say I don't know if they were, professors or what. The University of Colorado took a couple boas and they infected them with the virus that causes inclusion body disease. And yet they showed no clinical signs and dosed them and kept them for 2 years. At the end of the study, and they were still alive, eating, shedding, growing. And basically their experiment left more questions than answers because they euthanized them, which I don't agree with. And they took these animals and euthanized them when they should have, in my opinion, should have kept them and see if they would have cleared themselves eventually. It didn't go into their husbandry conditions of how they kept them, but I'm sure they kept them quite well since, They were knowledgeable in the reptile field. They probably kept them in their temperature gradient, probably kept them good humidity, food. I think that's the problem is how they get this viral infection is lower temperatures below 83 degrees, more like in the 70s, along with some stress without having adequate hides and eating frozen thawed rodents that don't have a polyphenol intake, these rodents in captivity, and those combinations can get them to get this viral infection where they can get sick and wind up progressing into inclusion body disease. And depending on the strain, it could be more severe than others. I believe they're not finding them in the wild because the disease in the wild, for the simple fact, these animals eat a variety of prey items. These variety of prey items that they eat are eating a variety of things. They're getting polyphenol intakes that they need. They're essential to the boas and pythons and things like that. And then these boas and pythons are consuming these prey items and they're getting the antioxidants they need to fight off any type of virus or bacteria infections they would normally get in the wild. They have the means to do that with the proper temperatures, more, the better humidities, the more consistent, we should say, temperatures and humidity, along with a variety of different food items. That's why they're not getting sick, but you bring them into captivity. These animals are caught in South America or wherever, and they're healthy, but it's to transition the United States and into these pet stores or these distributors or dealers or whoever, and their immune systems have been compromised, and this is where they can pick up this virus, and it can just wreak havoc in people's collections or in their, they don't really have you know, an idea. They're told that this is a retrovirus and it's totally deadly, 100% fatal, and there's just, it's going to wipe out your collection, and that, you know, and that's what they're told, and that's why they euthanize them. So it just, like I said, it all depends on the strain you're dealing with too. I believe that the strain that the little guy had that I was dealing with wasn't as severe as the main disease itself, even though it tested positive. I think if I would let it go and let it go and let it go, you know, without, because I wasn't given the polyphenols at the time. I just recently started researching all this and kind of putting two and two together to try to figure out, how do these animals get this virus? It seems like they get them out of thin air. You have people that have boas for 10, 15 years, even 20 years, never been exposed to other animals or anything like that, and they just wind up getting sick. They wind up catching this virus, and they wind up dying, and it's just a mystery. And it's only presumed that it was a carrier, which they can't prove that it was or wasn't. I don't think it was. I think they can literally catch this virus out of thin air just by, a deficiency in polyphenols, a little bit of stress, and that could be the trigger to this disease. This would go for nidovirus as well and ball pythons. I believe that there's also different strains of any type of snake virus out there. Some are going to be more severe than others. I think it could be treated with a polyphenol intake. I made previous videos of how I went about treating mine. And I think combination of that, the temperatures and hide boxes and good husbandry practices, the animal can be nursed back to health. And I believe that the virus, you can kill the virus. But this was just, I wanted to put this up here. This is a really good read. You know, I'm just sitting here looking through this. We can use, I read this several times, and then, see, they say there's no treatment for repnovirus, but what they're trying to say is there's no vaccine where you're going to walk into a pet store or into a veterinary clinic and say this animal's sick, and they give you a couple vaccinations and it's cured. It's not going to work that way. You're going to have to use the animal's immune system to fight the virus off. And of course, their boosted immune system will also, the white blood cells will fight off the bacteria, because that's what apparently this virus does. It attacks the white blood cells first. And it allows the bacteria infections to set in, which can go into the digestive tract, into the lungs, and the liver, and things of that sort, and could then start creating these inclusions on the cells of the animal. As far as that's what I gather from it all. But yeah, it's just knowledge I'm just trying to put out there and trying to help people out in case you have an animal that's sick and you're not sure. And you might have been told it had IBD, but you're not 100% sure. Like I said, I think it's a virus that could progress into IBD if you don't take the proper precautions. And that's another thing. If you handle your animals, make sure you hand sanitize if you have more than one boa or python. Hand sanitize between each handling. You come home from work, hand sanitize your hands. Make sure they're nice and clean before you go into your snake enclosures. I see YouTube people have, you know, 12, 15, 20 snakes. I don't know. And they go in there and they'll pull one out, and then they'll sit there and show it off, and then they'll just no hand sanitize, no nothing. They'll go in and pull another one out, and then they'll go pull another one out. And if this animal has any type of virus, for that matter, you're now passing that through your entire collection, potentially, and then you're going to have huge problems. Now you have all these sick snakes. If one of them, and it doesn't even have to be, well, as I was saying, I think this virus turns into IBD eventually. I think this disease starts out as a very minor disease, a very minor virus. Like the common cold in humans, it progresses, it progresses, it progresses. The temperatures are not quite where they should be. The humidity is not quite where it should be. Um, the humidity may not play much of a as big of a factor, but it should because of hydration purposes. You want the animals to stay hydrated, but at the same time, you don't want to oversaturate them. That and their feeding regimen with the lack of polyphenols, a high carb, intake on these frozen rodents instead of the polyphenol intake that we get in the wild. All these triggers could lead up to this virus progressing into this deadly IBD. That's my suspicion on how this whole IBD mess actually works. And that's about really all I have for now. I'll post a link to this article and a link to that video in the description. You can look and see them talking about how they did all these tests with these boas by injecting them with this virus. And they didn't fall clinically ill. Well, I think one ball python did, but like I said, for me, it left more questions than answers anyway. But, I had my own hands experience with it, and I'm dealing with it, and I'm having really good results. Oh man, I had to cough there. But, yeah, so if you're told your snake has IBD, I really don't think it's, well, you should take it seriously and take the precautions. And if you want to nurse, if it's your one and only snake and you want to save this snake, I believe it's definitely very doable. And I don't believe it's going to be a forever carrier of this virus because I really don't believe it's a retrovirus. And according to this article, they're not even sure the type of virus. They're just, going by what it looks like to them and how it acts. But like I said, there's different strains out there, and I think they have different behavioral methods, and that's what leads to all this confusion. All right, that's about it, and you guys have a good day.